we're discussing today is huge. It's huge. Approximately 80% of human trafficking is allocated to forced prostitution. 40% of those trafficked in Southeast Asia will end up in America or Europe. So majority of them will end up, and you ask why maybe, and it's because America is the #1 consumer of human trafficking. This is due to national and international consumption of commercialized sex pornography. So it's a real issue that needs to be discussed and needs to be put out on the forefront for us to learn more about and educate ourselves about, and how many of our works that are viewing in today are just wanting basic information, and we hope to leave you with how you can get plugged in and maybe start making a difference and an impact in your community. I'm going to start right off into our panelists. And I did want to say your bios were emailed out. If you did not get the bios of our panelists today, please leave that in the chat and we'll make sure to get that sent to you. We didn't want to take time from our questions to go over that, but we do want you to know the important women that we have on this panel list today. I'm going to start with Mary. We're going to start with you, Mary. And how do you recognize that a person is a victim of trafficking? And are there signs you look for?
Yeah, absolutely. You know, people are struggling right now, especially victims of human trafficking, and many of us want to help. And what you need to know is that victims are living in every zip code of our community, are many different ages, and the identifying signs vary between ages. For example, in young children, victims will often have poor or neglected health care, physical signs of bruising, and abdominal and genital pain. Those on the front line who often identify young victims are medical professionals, babysitters, nursery volunteers, and preschool teachers. Elementary children manifest as victims, often having unhealthy bonds to an older sibling, parent, or family friend. Maybe the quiet, withdrawn child in the home or the classroom, skittish to touch, and also may have chronic abdominal and genital pain. Those on the front line to identify these victims are school teachers, counselors, primary caregivers, and medical professionals. Teenage victims are often described as angry because they're holding a dark secret. They may have aggressive behavior, extremely fatigued in the mornings, have a hard time concentrating at school, come late to school, and eventually may not attend for days at a time. Their grades drop. Their friend group is characterized by rebellion to authority. They may be meeting an older person after school and changing into seductive clothing, have sexualized images on social media, and have friends who are either grooming them or using them, may have unwanted pregnancies resulting in abortions, which bring immediate depression. And almost always, there are signs of drug abuse. Those on the front line to identify these victims are often families, teachers, counselors, coaches, youth leaders, medical professionals, law enforcement, correctional facilities, and rehab centers. And finally, college-aged and older victims usually withdraw from formalized schooling, have little or no contact with family and friends, neglected health care, many have STDs, often are wearing seductive clothing, have tattoos and branding, work social media and on their phone constantly, have social media images that are sexual with money and guns, have growing signs of drug abuse with sores around their mouth, scratches on their body, needle marks on their arms, weight loss, extreme paranoia, and restlessness. There's always an obsession with someone who is either a boyfriend, a mother, or a father figure. We say, if you find the dope man, you will find victims. Those on the front line to identify these victims are usually rehab counselors and staff, medical professionals, law enforcement, judges, employers, neighbors, and friends.
Thank you, Mary. And that just gives us such a wealth of knowledge that many of us serve in one of those roles you just said. So what you're saying is all of us bringing awareness and attention is the best factor in being able to identify that. So in speaking of that, Becky, in your role, what is the process to get her out of that situation?
Well, I think it's really important to remember what it means to, quote unquote, get someone out of a situation. I think it's important to understand that agency, and we have to be really cognizant of that with human trafficking. There's an unfortunate trend in the anti-trafficking field that's been there for decades, since I started working in the field 10 years ago, where there's this impetus to rescue someone. And you'll find that phrase in a lot of different, even organizational names and their mission statements and their vernacular when they're talking to a victim even. And it's really something that should be concerning to all of us, because when we're talking about rescuing someone from a situation of trafficking, that means that we're taking away their agency, and we are kind of creating a power dynamic and a power structure that's already in place between that victim and their trafficker. So when we come in and we say we're going to rescue someone from a human trafficking situation, it then means that we are the rescuers, they are the rescuees, and we create a power dynamic that is very unhealthy and is not supportive of trauma-informed care and empowerment. So I wanted to lay that out first, that we do have a culture within the anti-trafficking field that has this idea around kind of swooping in and taking someone out of a situation. And it's really much more complicated than that. And I think the reason that it's much more complicated than that are a lot of the things that Mary was mentioning around identifiers of trafficking is very complicated. It involves complex systems of abuse. It also involves complex trauma. And it involves, for the most part, especially when we're talking about sex trafficking, a relationship with an intimate partner or with a family member who is trafficking that individual. So there is a relationship that is built around power and control. That power and control can manifest in a lot of different ways. And if we have this idea that getting someone out of a trafficking situation, that all it takes is us swooping in and saying, poof, you're rescued, it is really not helpful to that individual in helping them to see pathways to healing, helping them to understand that the abuse that they're experiencing is not okay. It's something that's actually against the law. There are, ways that we can hold a trafficker accountable for that. And that, there are resources and support out there. So I think obviously the starting point is those identifiers. It's important for us to be able to identify trafficking where it's happening. And it's also important for us to know the full breadth and depth of what trafficking is, so that we're not putting it in a kind of other group or category saying, all trafficking victims are being shackled and held in basements. We have many, many, many cases of trafficking victims who are being trafficked by their spouse, by their intimate partner, by their parents, by a family member, a grandparent, aunt, uncle. So it's really important to understand those complexities in our ability to be able to recognize trafficking and to offer services and support. So we first have to start with knowing what trafficking is, knowing those identifiers, and being able to offer options for that person. And that's really what we do at the Family Safety Center. We offer options and we allow that person to guide their own path. And that's really critical to a trafficking victim being able to leave their situation and get on the pathway to healing.
Wonderful, Becky. If we walk away today with just that breadth of understanding of like what we're talking about here is not shackles, what we kind of sometimes see that image of, that's a very good point. It's great. And going into more specifics, Jane, I'm going to ask you is, from your experience at the next door and encountering a woman in this situation, does a woman really self-identify as a victim of trafficking? Does she know that term, or is that not really, is that wrong to categorize that? And can you share anything about that?
Yeah, absolutely. I think for those of you who maybe have seen in the news, about a year ago, Centoya Brown was in the popular news nationwide, and she talked a lot about this in terms of sort of the process of recognizing, you know, maybe what she thought was initially consensual, later through her healing process realized, you know, it really wasn't, that what was happening to me was not okay. Even if she didn't necessarily see that and identify with that from the beginning. You know, but I think in general, studies have shown that people are more likely to endorse like behavioral descriptions rather than labels, right? So somebody might not say that they were raped, but will say, well, maybe somebody had sex with me against my consent, right? Same thing essentially, but shying away from that label. So if we're asking clients, you know, are you a victim of human trafficking? And that's it, we're likely to miss a lot of women for whom that would apply, but maybe don't feel comfortable attaching themselves to that label, right? And at the same time, we also want to be careful not to assign labels to people for whom it's not true. Certainly, we want to support the healing process and the recognition of the things that have happened to them, but we also don't want to say to somebody, well, you are a victim of trafficking, if they truly were involved in consensual sex work, right? So we want to just be really careful in looking at the person, the woman, as a human being, as a complex individual, and support their healing process of really recognizing, this is what I experienced, maybe I was a victim, you know, and support them through that.
Wonderful. Thank you, Jane. And speaking of labels, not labels, Tia, can you clarify the terms victim of trafficking versus survivor, and really what is the best for all of us here, maybe learning about this, for all of us to use? What kind of terminology, if there is any?
Yeah, so a lot of what we do at In Slavery is, of course, we talk about trauma-informed care every day. Every day that we come into work, that's what we're focused on, and how can we offer these survivors the best care and meet them where they're at. And a lot of the panelists have talked about giving power back to the survivor and not taking that away, and not conforming to this power of control that so often these survivors are caught in. And so by referring to our clients as survivors and not victims, we are giving them that power back and showing them that they have power of their healing journey. And so a lot of what I do as intervention coordinator, I am meeting with these survivors for the first time, and they may not identify, they may not know to identify as a trafficking survivor, because what they have experienced, as some people have said already, to them is an intimate relationship, and it's coming from someone who does care about them. And so they didn't feel like a victim, or they didn't understand what was happening. And so by using the term survivor, we're giving that power back to them, and we're allowing them to take ownership of their healing journey. And a lot of what we do is say that we meet you where you're at. And in that, we give grace and acceptance. And by using survivor, we're kind of setting the tone for that, rather than victim. And that's something that I carry through. You know, often I work with law enforcement on stings or with emergency referrals, or, you know, what have you. And victim is, of course, terminology that they use. And so I will correct or put into the conversation the word survivor, because it's a vulnerable time for these people who, you know, have all of a sudden been told you're a victim of something that they might not have known that they are a victim of. And so by giving them the term survivor, it's letting them take ownership of their journey and the strength that they have to keep going forward and to keep moving forward with the perspective that they have that strength and they can get through it in such a vulnerable time.
Absolutely. Thank you, Tia. And Mary, this question comes up often. We see it in news. We see it everywhere. Is trafficking prostitution?
Legally, no, Amanda. However, the work we do at NAHT does not delineate. We know that girls and women who are selling their bodies are never truly going it alone. Someone is always exploiting them for personal gain, and most often it is the drug man or woman.
Which goes back to the conversation at the beginning about what is human trafficking we're talking about, right? So the
Yeah.
exploitation of someone, right, for goods. Absolutely. Thank you. And Becky, does forced labor fall under the definition of human trafficking?
Yeah, it absolutely does. So I know we're primarily talking about sex trafficking in a lot of these questions and with a lot of our answers, but I think it's important to highlight that the phrase human trafficking covers both labor and sex trafficking. Labor trafficking is very often left out because trafficking is such a larger focus of the anti-trafficking field. So forced labor is a part of that. The actual language around it is forced labor, services, or servitude. And so when you're looking through both our state law, the Tennessee state law, and the Trafficking Victims Protection Act, which is the federal law, it points to forced labor as the other component of human trafficking. So it's important when we talk about human trafficking to talk about it in broader terms, even though I know it's very hard. We tend to, really hone in and focus on sex trafficking, but we end up missing this whole pot of victims who are experiencing forced labor and services or servitude. And also for those of you who are specifically serving sex trafficking victims, you'll also be missing sex trafficking victims as well, because the two crimes can intersect and overlap often in the same way that trafficking overlaps and intersects with child abuse, with domestic violence, with sexual assault, with gang-related violence, with elder abuse even. So there's a lot of intersectionality, and if we don't look at the labor, services, and servitude side, we're missing a whole group of trafficking victims. I also wanted to just speak really quickly to the word trafficking and talking about what does it really mean? What does it really say to a victim when we're talking about trafficking? In my experience, it can be really confusing because it's a confusing term. I worked on the National Human Trafficking Hotline for several years, and I never had a person contact the hotline who said, "Hey, I'm a victim of human trafficking." And granted, this was 11 years ago, trafficking awareness was much lower, but it is very rarely the presentation, which I think Tia was speaking to a little bit, is oftentimes people are coming in and they're presenting with a particular victim experience that they've had, a lived experience they've had, and it may not first be the trafficking experience. They may be coming to speak about childhood sexual abuse. And then through the work with their therapists, they're learning that they also have been or are currently being exploited. So I think it's important with the term trafficking to really talk about exploitation. That was always how it started to make a little bit more sense when we're talking with survivors who call into the hotline, was talking about exploitation and abuse. And those terms made a little more sense than trafficking, which has a relation to drug trafficking, arms trafficking. It sounds like there has to be movement. You hear people talk about that all the time on the news, where we're a huge place for trafficking because we have this highway and this highway, and every state in the country has highways. So it's always one of those things that just grades on me that, that movement is not required for trafficking. And
this is about trafficking, and I invited Chris's group to be a part of this.
It gets just misleading for our general public when they think that we're talking about something that requires movement, and then that trickles down to the work with people who are experiencing that exploitation and abuse, because they think this doesn't fit what my experience is. I wasn't moved around. I was sold out of my house by my mom for drugs. So I guess that doesn't fit. So I think it's important to be broad in our definition, make sure we're including labor trafficking, but also when we're speaking about this, to speak about it in terms of exploitative abuse. And to Tia's point as well about survivor or victim, it's just kind of a perennial debate in victim services. And I think her point and Jane's point as well, she brought this up, of really meeting the person where they are and talking about this as a lived experience. Because any term we place on someone can feel like it's our term. So it's better just in a lot of ways to talk about what they've experienced versus that experience then makes them a specific term for us, because they're so much more than a victim or so much more than a survivor. They're a whole person.
Right. Great point, Becky. I'm going to go off of some questions here, but how would we, and this may not be a fair, but how would we identify kind of forced labor? Is there, Mary talked really great about earlier on one of our first questions, but is there any way kind of identifying factors, those of us in the community or that work in the field, both and, that could identify that? Becky or Mary or Tia, any one of you want to jump on that?
I think for us, what's important, when I do my program assessments with these survivors or referrals, I kind of separate it from labor trafficking versus sex trafficking, because while they do present very similarly, in some ways they are different. And so I think it's about the questions that I ask. And so we ask for most recent work history, and then we have a labor trafficking assessment that we use. And so a lot of those questions are, has anyone, while working, has anyone ever withheld payment from you, given your payment to someone else, controlled the payment that you should have been paid, deceive you about the nature of your job, change the conditions of your job over time, take or keep your identifications, make you feel like you could not leave or resign. And what I find in a lot of my program assessments is that they don't think that any of these things have happened. And then we get in these conversations and I start asking these questions, and they'll be like, well, I was told that I was going to be a waitress, and then it ended up being something completely different. Or I was told that I was going to be a babysitter for the family kids, and it turned into something completely different. And so by asking these specific questions, they're able to differentiate and see, wow, these things that I thought were jobs that I was receiving proper pay for, or maybe they were even on a payroll, they realized that it was something completely different. So I think the nature of the questions and kind of dividing it up can be helpful, because like many of us have said, a lot of these women don't, or men, don't know that, or don't identify with the things that have happened to them in the way that we would identify the trauma as. And so by asking these questions, it kind of, so many times I see this light bulb go off in their, eyes when I do these assessments, and they'll be like, oh my goodness, I had no idea that was happening to me, but that is what was happening. And so that's that moment of realization for them based on the questions, is really interesting to see.
What power that can be for someone, right? To really kind of like the curtains unfolded, and if we can walk along those people to get to the other side of that. Thank you for bringing that up, Becky. I think that's very important for us to continue to go back to, that it's more than just sex trafficking. Thank you for honing in on that. And speaking a little bit more to that, Tia, and going into like the correlation with addiction and trafficking, what is the connection of that, and how often do these go hand in hand? I think we've heard that there definitely is correlation, and in the statistics I shared at the beginning, they were obvious. But can you talk a little bit more about that, Tia?
Yeah, and I'll start by speaking to personal experience in, my position, the overlap of getting referrals from the next door, which is probably one of my greatest referral sources, and just other treatment centers is very high, and probably one of the highest, if not the highest referral source. And so just even in that, and where our referrals are coming from, a lot of that is coming from treatment centers, and they go to get help for addiction or substance abuse, and through conversation, their case manager or their therapist may pick up on something. And so we have talked quite a bit about, and I know Becky mentioned that nobody generally calls and says, I identify as a trafficking victim. That's very, very rare. And so we're getting referrals from sources that are addressing other parts of their complex trauma. And so while they're getting treatment for addiction or substance abuse, it may come to light by a case manager or a therapist. And so in that way, we get a lot of referrals. And I think when we do get these clients, we like to think that the first thing that we can address is their trafficking trauma, but that's not the case usually, because as many of us have mentioned, they have such complex trauma and they come from vulnerable populations and have been put in situations where they have just so much more that they have to work through. And often the trafficking trauma is the last thing we get to address, at least in slavery. And so we try to address any of those things up front. And a lot of times that is getting someone into treatment before we can get them started in therapy and things like that. And so the overlap is really high, even just from referral sources.
Right. And I think that what you said is the long-term relationship is key, right?
Mm-hmm.
So talking a little bit, Jane, in your experience, which comes first, the trafficking situation and then substance abuse and addiction, or is the person addicted and then, gets into a situation?
So I would say it really could be both. Trauma in general is connected to substance use in primarily 3 different ways, right? The self-medication piece of wanting to treat the traumatic symptoms, that is certainly a big piece of how they interact. Drug and alcohol use and abuse also maybe put people at increased risk of victimization, put them in vulnerable positions that maybe increase their risk of being exploited or experiencing a traumatic event. And then also drug and alcohol abuse increase the risk of developing PTSD after a traumatic event, right? So somebody may start in any one of those pieces of that triad and move around, right? That there's no clear-cut answer to that. They really overlap. And of course, as we've discussed, right, trauma in general and substance abuse are strongly correlated. We certainly see that here at the Next Door, that many of our clients have experienced trauma, including the complex trauma related to trafficking and exploitation. But I think, when we talk about this specifically in terms of how drugs and alcohol are maybe used in the trafficking environment or in the situation, it can really be used by the exploiters or the traffickers as a form of manipulation. Just keeping somebody so high that they don't totally know what's going on around them. I've also even heard people talk about how the physical dependency on the substance was also used as a form of manipulation, right? As we said, right, that trafficking victims are not locked away in basements all the time. And one of the ways that they can be kept sort of in the situation is through the physical dependency on the substance, right? Had clients say to me, I didn't have to worry about, I knew where I could get my drugs, so I didn't have to get dope sick, right? And that's what kept them in that scenario, even though they did know what was going on. So I think all of those things are different ways in which the substance use and the trafficking can really just sort of goes back and forth. And of course, addiction puts, unfortunately, people in, addiction and homelessness go hand in hand. And homelessness can make women very vulnerable. They may seek a protector, right? This person will probably hurt me, but maybe they'll also protect me at the same time. And that dynamic can play a role in a trafficking situation as well.
Right. Thank you, Jane. Tia, what types of trafficking exist in Tennessee?
All kinds. It is not limited to labor trafficking. It is not limited to sex trafficking. We see all kinds. And we have talked about how people's experiences go hand in hand, and they may have experienced both and not recognized it. But I would say mostly here at In Slavery, we work with survivors who do identify as sex trafficking survivors. We do work with people who have been labor trafficked and do identify with that, but mostly we do see sex trafficking here at In Slavery. But all types do overlap, and we've had Becky speaks really well on how you may not realize that you have experienced both, or that using the term trafficking can get very confusing for people, because I do hear often, I wasn't taking over state lines or anything like that. I was just using, I was just trading sex for housing, and so explaining that trading sex for money, food, housing, or drugs, and being coerced into that is trafficking, or all of the questions I listed for labor trafficking. So we see all kinds of trafficking here in Tennessee, and it isn't limited to one kind. And then there's, of course, variations of all of that. And so definitely not limited and pretty expansive in what we see here.
Yes. And Mary, what is the impact trafficking is having on Middle Tennessee? Can we hone in a little bit more and get an understanding of that?
Yeah, absolutely. I would say that the impact is seen daily in the destruction of families and the lives of both victims and perpetrators. Slavery is never neutral or benign. Its impact reaches into every home. And we all have cell phones. And I think everybody needs to be super aware of the fact that this is the key to the spread of the human trafficking industry and the way it is run. Through our cell phones, images of and invitations to objectify girls and women fuel an industry that operates on supply and demand. Traffickers are skilled businessmen and women who understand how to create demand and supply what is needed to meet the demand. Middle Tennessee is an affluent southern region with plenty of money for boys and men to daily fuel the human trafficking empire, which undermines the golden rule of do unto others as you would have them do unto you. It fosters a sense of entitlement, and it is without question destroying families and lives in our Middle Tennessee area.
Yes, thank you, Mary. Becky, we had a question come in, and also I'm going to ask you the next question we had on our list is describe the breadth of services needed to support a woman or man, but we're speaking of women right now, who has been trafficked: legal, healthcare, therapy, family services, etc. Can you talk a little bit about the depth that goes into treating someone?
Sure. Yeah. So you mentioned several different areas where we need to have supportive services for survivors. And I think it's something that's important not to reinvent the wheel. Again, just in working on this throughout the country, I've seen in a lot of different places, they'll say, we need to start something completely new and completely different. And it goes back to this idea of kind of otherizing people who've experienced trafficking versus people who have experienced child abuse, domestic violence, sexual assault, other forms of addiction, and other abusive experiences. So one of the things that I like to talk with communities about is that they have a lot of the tools ready and available to them. It just takes having a lens of what is human trafficking, what is the experience of someone who's been exploited, and how do we adapt our services to be able to serve those individuals. Because trafficking survivors need all the services that a survivor of child sexual abuse would need, that a survivor of sexual assault would need, a survivor of domestic violence. These are all forms of complex trauma. And so it's really important for us to look at what existing services are out there. When I managed a task force in Denver on human trafficking, I feel like at least every week, we'd have a new person call and say, hey, I heard about trafficking and I'm gonna start a new organization and we're gonna just address it. And I heard about it through watching a documentary. And so I am now an expert and I'm gonna jump in and do this work. And I think it's really important to make sure that we do have experts that understand victim services, trauma-informed care, how to be empowering in our healing process and the services that we're offering for survivors, and to understand that trafficking victims are varied. They have varied experiences, just like someone who's experiencing intimate partner abuse. Their trafficking experience will not be the same as every other trafficking victim's experience. We have to be really careful about that. Another example of that is where working on the hotline, oftentimes when we would call out for services for a trafficking survivor, the service provider, not understanding that varied experience of trafficking victims, would immediately assume that trafficking meant organized crime, meant that the trafficker is a threat to our shelter and will come and seek out this victim in a very aggressive way, and therefore we can't provide that person with services. So all of these misconceptions that we've kind of briefly touched on here and there really feed into a lot of difficulty in providing those services, because people are making assumptions about what someone's experience is. So again, important, as several people on the panel have mentioned, to meet the person where they are and to look at what their needs are, which include legal needs, for example, maybe securing legal remedies like a T visa and a U visa that are looking at, if they don't have legal status here in the United States, that can help them secure that, both the T and U visa. The T is specific to trafficking. The U visa has all components of labor and sex trafficking included in it. For legal remedies, they also may need an order of protection. They may need to get custody of their children. They may need help for filing a divorce. So again, this goes back to recognizing that sometimes that person's trafficker is also their spouse. So lots of similar needs to some of our other victimization types. With healthcare needs, it's really important to do full medical assessments, both for labor and sex trafficking. There can be a lot of neglected medical needs that have not been met while being trafficked, particularly with labor trafficking. We would see a lot of cases where injuries were allowed to fester, there was no medical treatment provided, and that person's injury then grew into something much, much worse. We see a lot of need on the Cherished Hearts Human Trafficking Court that we're on for healthcare services, particularly for dental services as well. So any of those medical needs that are being neglected because the trafficker is not allowing them to access medical services are important. I will say, again, another caveat, many studies have looked at how many times a survivor is able to encounter a medical provider, and they're often actually fairly high rates of the trafficking individual who's being trafficked while they're being trafficked able to access medical care. So those can be really important identification points. It may be allowing them to access that care so that they can continue working. So important intervention point there as well. And of course, therapy, case management is huge in coordinating all of the services between all of the partners. And of course, really important to have therapeutic care that understands the complex trauma of trafficking and the multiple intersecting abuses that can go along with it.
Which is really important for referral partners, right? To be familiar in your community with who to refer to. Hence, you've heard Tia and Jane talk a little bit about that they don't walk in always with, a label, but we discover that as therapy happens. And the question came through, Becky, that you may be the best to answer, but where does Medicaid expansion fall in terms of prevention, rehabilitation, and mental health for substance abuse and trafficking, and/or mental health professionals in communities to address these issues?
I don't know that I'm the best person to
Mary?
Medicaid expansion. It may be Tia or Jane there, but I think it's very important to have additional services provided through that expansion.
I mean, I guess I can step in briefly. Again, I don't know that I'm the best person, but I will say reducing any possible barrier to receiving care works in the favor of healing and treatment. So the more options that there are to find providers to have the insurance, the Medicaid plan to get into a treatment center, just, I think reducing barriers is always going to be the answer. So.
Yes. Anybody else want to add anything before I go forward?
We find in our interventions that often, there's a small window of time where a girl is open to making a change and to possibly leaving her environment and going to get help. And that window is very narrow. And if you can find a door that is open for her to go get treatment, the likelihood of her being inspired that there is hope for change and lasting change is very, very important in her becoming, moving out of that victim and into more of a survivor role. And we are so thankful for the number of people that work with us and try to help, take that girl in that little window of time and make sure she gets help as quickly as possible.
Right. Which circles us back to warm handoffs, right? If we can,
Mm-hmm.
walk someone literally side by side, shoulder to shoulder with them to get the care, we kind of reduce the risk of that gap that they could fall in, right? And not get the services or care they need. Absolutely. Good word. Let's go back to our questions here. Jane, can you describe the long-term treatment needs of a woman who has been trafficked and is also addicted to drugs? And what are the barriers or challenges to maintaining sobriety after getting out of an unsafe situation and finishing residential treatment? We touched on this a little bit, but can you talk a little bit about that from your perspective?
Yeah, absolutely. And first, just talk about addiction treatment in general, being far more than just detoxing a person off of a substance. We at the Next Door believe strongly in having a full continuum of care and full continuum of services, from the medically assisted detox, residential treatment, partial hospitalization, intensive outpatient, and then aftercare and other ongoing support programs, just to help keep people who are in recovery connected, and keep focusing on their recovery, so that they are able to maintain that recovery long term. When it comes to having a trauma history, trauma symptoms, PTSD, as was alluded to before, right, that we don't want to start with reprocessing somebody's trauma when they were using last week, right? That's just really not necessarily an ideal way to go about it. So most of the evidence-based trauma treatment modalities do require that first stage of stabilization and creating safety. That stage is why these sort of community partners are so important, so that we can put somebody in a place that they can address their trauma in a therapeutic way while maintaining their safety and their sobriety throughout it. So I think just knowing the length of time that can take is really important, and really giving the support and the stability, an ability for them to maintain that while they go about their healing process. And it's not always just strictly like doing EMDR or other sort of specific trauma treatment modalities, although that's certainly important to reduce any PTSD symptoms. But it's also things like rebuilding your sense of self-worth separate from the dollar amount that was attached to you. Or rebuilding relationships in your family that may have been negatively impacted as well. This doesn't only hurt the person in the situation, it may also be impacting their loved ones. And those are relationships that need to be looked at as well. And of course, as we've talked about, right, that this isn't necessarily happening from a stranger, right? It is a partner, it's a spouse, it's a family member, it's a friend. And they, the people who come through our doors who have this history may still love that person, right? And often do. And navigating that complicated feeling that they have towards the person who exploited them. Those are all, things to consider as part of the healing process. And, I think it's also important to think about when we're supporting the survivors in their healing process is also the risk of trauma reminders or re-traumatization. If they are involved, for example, in ongoing legal investigations, have to testify against their trafficker, or in like a parole hearing type situation. Those types of things, unfortunately, can be very vulnerable moments for them that may lead to relapse. And being mindful of that is important when we're looking at supporting them through this process.
Yes, thank you, Jane. Great information. And Tia, since we talked about referrals and back and forth, but at what point does a woman need treatment for her addiction as a survivor that you may be working with?
And that is circumstantial for sure. Like I said before, a lot of the referrals that I get are actually from you guys, from the next door. And so for a lot of them, that's how we get them, and that's how they are referred to us. And so they're already addressing that piece of, their healing journey and starting that. But for the survivors that we work with who don't come from you guys or from another treatment center, it's very important that we get that started as quickly as possible. And so when we get the referral and we do the program assessment and they meet criteria and we do take them on as a client, basically our first step is to try and get them into treatment. Of course, we're always going to try for residential. We're always going to try to get them in there for that 30 days. But that could look like IOP, and things like that. And so we try and get that started as quickly as we can, just so we can get that piece addressed and start moving forward. And so as soon as we can, if they're not coming from a treatment center, as soon as we can, getting that kick started is really important, just to get them stabilized so we can start moving forward.
Great. Thank you, Tia. And Jane, back at you, but what is the prevalence of trafficking among the women at the next door? And if you have, an example, a broad example that you could share.
Yeah, so again, as we've discussed, so there's often situation in which we may not recognize, at least from the front end, that this may be something that they've experienced. So it's hard to say what the rate of this is. I will say in general, we often have at least several clients who either have openly shared it or maybe just came to their case manager and said, I was looking at these housing resources and I think end slavery might be a good option for me. I qualify for them. And that's all we ever know about their background, right? But I'm hesitant to talk about any specific cases just for the sake of confidentiality and any ongoing legal stuff going on. However, as we've shared, there is no one clear picture of what a victim or a survivor looks like. And we have seen across the board how this impacts different people, right? We've had, with young adults still in their teens, all the way to women in their 50s. We've had it happen locally, and we've had people who came to us after being trafficked elsewhere in the country. We have seen, primarily it is the sex trafficking, but also the forced labor exploitation we've seen as well. And we've had people come who were literally being trafficked just days before, all the way to people who experienced it years or even decades ago, who then, the substance abuse continued and they are now seeking treatment. So I think it's, it's hard to say a number, but it is important to know that we can't look, there's no one particular thing to look for when we're looking to identify our clients who may have experienced this.
Right, thank you, Jane. And this question I think maybe come through a little bit, and Kate's probably walking it to me, but I think I saw it pop up a little bit. But Mary, can you talk about why are partnerships in the community so important to treat this important issue?
Yeah. NAHT relies heavily on partnerships because we've learned real early on in this process that it is not a sprint, that it's a marathon. And this healing journey that everybody I know that's in this space knows is that it is not going to happen overnight. And it takes a real team to wrap around these girls and to provide the long-term care that they need to deal deep wounds that usually, for most of the women that we've worked with, started as children. I hope we've seen today, and for everybody who is listening, the broad impact that human trafficking is having in Middle Tennessee. But most importantly, on people's lives. These are people. Sometimes in the industry, we see them as people because we're interacting with them day in and day out. But for people who are unfamiliar with human trafficking and are not in this field day in and day out, it's this distant reality. It's this thing that happens to somebody over there. And what I would love for everybody to hear today is that these are people created in the image of God that had moms and had dads and had families. And, there was trauma that broke in and devastated a unit, and people were left vulnerable, and this industry preyed on that vulnerability. And so, the problem of modern day slavery is massive in scale, and it cannot be addressed by any one organization. We must, I feel like, work together in order to inspire hope in families and victims and perpetrators, that there is love, there is forgiveness, and there is power to change, and it's available to them. I do believe that we as a community of nonprofits must encourage and support each other as we come together for the greater good of our community. And we need to lead by example as we support and love one another on the front lines of the battle against human trafficking. And the stronger we are collectively, the greater impact we're going to have in Middle Tennessee.
Wonderful, Mary. Somebody asked a question, is what can the faith community to support this? And I think you've hit out, what can the faith community do to support this work? Many churches are interested, they're just maybe scared or don't know what steps to take. Is there any direction you could give to those?
Yeah, we exist to provide pathways for the church to get involved, and community groups. But we really learned early on as we started out as a missional community of Christ Presbyterian Church that, there were so many people that wanted to do something, but they just did not know what to do. Mm-hmm. And so you can look at our website and sign up for our training that happens the first Tuesday of every month, and learn ways that not only, or learn more about the human trafficking issue, but then also more practical ways that you can get involved, and other organizations that you can partner with as well. So that's part of what we do.
Wonderful. Great.
And I'm going to jump in on that question a little bit there. In slavery, there are multiple ways for the faith community to get involved. First of all, just having a church for our clients to go to. A lot of our women or clients find a lot of solace and peace in going and being part of that kind of community. But secondly, as part of In Slavery, we're starting In Slavery Sundays. And so if you wanted to take the tithe that you collect and give that to In Slavery, there are ways that you can connect with our development team and get that started. Or if you simply just want to let us know that you are a resource for food boxes, then contact us through our website. Anything like that, just feel free to go to our website and get linked to the development team and find ways that you can help. And our website is a phenomenal resource for people to learn. We have excellent training courses that you can complete online and get certificates for, and just links to articles and things like that. And so if you are interested in helping specific agencies, then that is a way to do that.
Great. Thank you, Tia. Someone asked about the screening. This is being recorded. And Kate, are we planning that could be sent out in any shape if someone's interested, because they're screening. Mary talked great about screening, not really in a formal sense of an assessment, but things that the community could be aware of in different roles. Are we going to have that available, Kate?
Absolutely. I will send the recording and the bios to anyone I have an email address for. And if you haven't put in the chat your email address, just so I know who's on the call, please do that.
Yes, sounds good. And for wrap this up, great information we've had today, and phenomenal women sharing with us. If we've got a community, and wow, the numbers have just been climbing really since we've been on this, and in the room downstairs here at the next door. And I would love, when you sit in these things, you want to walk away with one tangible thing that we could walk away and maybe go make a difference. And Tia shared a little bit about that. Mary did as well. Any of you want to share a way that you can, our people watching can walk away with and get involved?
Yeah, I think that it's really important to truly understand what trafficking is first and foremost. So like I mentioned before, a lot of times, really well-intentioned people want to get involved after they've seen a news story or watched a documentary. And it's really important to dig into that a little bit more than, the surface. And because it can be easy to make assumptions and really buy into a lot of those misconceptions. So it's really important to be well informed about what trafficking looks like, and what our particular role can be. So, you know, to your question about faith communities, there's a lot of great ways to support organizations that are doing the work out there. There's a lot of great ways that within your faith community, you can prepare yourself to have potential disclosures with your faith community. There are a lot of people that find that place is the place that they go to for advice, for information, to talk through the things that are going on in their lives. And that's something that we at the Office of Family Safety look at with a lot of, you know, our community groups and agencies around all different types of interpersonal violence. It's typically not that person's first outreach is going to be to a service provider. Their first outreach is going to be to someone they trust, and that person they trust may be in the faith community. So it's important to be able to receive that information and to really be able to work with your community provider on how we respond to that. You know, we see that in domestic violence all the time when someone is coming out to a faith provider and the faith provider is maybe saying things that communicate blame or shame, even though they're not meaning to. So just giving, you know, some understanding of how you can be really supportive to someone in your congregation can be so helpful, and knowing the resources of where to refer them to the professionals for assistance is really great. And I would also just say, you know, making sure that you know what's out there, learn more about what the Next Door is doing and what End Slavery is doing, and, you know, learn about what's going on in Nashville and all the collaboration that's going on, because we have a lot of great things going on in our city, a lot of great responses to this issue and several others. And I'll just do a real quick personal plug for the Family Justice Centers. Just most people don't know that we have the largest family justice center in the country. And to the question about partnerships, it is absolutely important that we have those warm handoffs that you talked about, Amanda. And a family justice center is exactly the place for that. So we have 2 centers. We have one in the courthouse, and we now have one on Murfreesboro Pike, which is the background I have here of our family room for that center. We have providers that are all located there on site. So if someone comes in who's experienced trafficking, they have access to a therapist if they'd like to speak with someone, to a case manager through our office. They can get a safety plan, they can get an order of protection, they can get referred to End Slavery. Let's say they need shelter, let's say they need substance use treatment and need to go to the Next Door. We have all of those referrals, and we have a lot of folks that are located here all in one place. So please, you know what's out there and know how you can refer people, because that's one of the greatest things you can do.
Absolutely. I think that answers the question that just came in, Becky, is when someone works with someone in the 12-step program, how do we help a survivor? And I think it's that warm handoff. Any of us can do that. And it's walking someone to a resource and not just giving it to them, but maybe walking alongside them to get to that resource and make that connection. Good word, Becky. Thank you. Tia, Mary, Jane, any last tips real quick? We need to make them brief to respect people's times, and yours too.
Yeah, I just want to say that I think there is power in educating yourself, and finding those resources and starting that is going to be a great place to start. And a lot of that can be done. I mean, I'll go back to our website. We have online training courses and plenty of articles that you can read, and just submerge yourself in the education that is out there for you, because in Nashville we do have a great community that we all are very cooperative with each other and rely on each other a lot, because we know it can't just be one of us. And so learning all you can and submersing yourself in that information is going to be the most powerful thing that you can do as an individual.
Beautiful. Thank you, Tia.
Yeah, I was just gonna piggyback off of what Tia and Becky had said in terms of the education, but also maybe a little bit of self-reflection on your own maybe preconceived notions or values that might be butting up against some of this information. I love the energy of the wanting to help and to support, and sometimes that starts with the education piece, and also just self-reflecting of what role you might play, and how can I best support these women and men who have been through really traumatic experiences, but may look, or the situation may look differently than what you think it does. So.
Thank you, Jane. Mary?
Amanda, I'd like to tap in and just say that if somebody were to, after watching this today, bump into someone in their community that they think was a trafficking victim, or they engage with someone, which after this event today, the likelihood of you being able to identify someone is greater. Take a deep breath and recognize that it's not up to you to solve the problem immediately. There's lots of solutions, lots of options, and probably the best thing you can do is listen and be a safe place for them just to share what's on their heart. And then pray and ask, for guidance on where best to lead them and direct them. And I think it's just great that y'all have done this today, because hopefully everybody knows there's lots of options.
Absolutely, Mary. And I'm just encouraged, grinning from ear to ear if I could, but with just the response. So thank you all for attending. If you have any lingering questions, please don't hesitate to reach out to Kate or April, even myself. Our emails are easy here, and we can direct you to one of our panelists, but as well as their bios. You can reach out to them directly. And thank you so much, Mary, Becky, Jane, and Tia. What a wealth of knowledge and incredible women. So thank you for sharing with all of us. May you each have a great Tuesday afternoon. Thanks, everyone.
Thank you for coming.